Why are people so concerned about insulin resistance? Let's just give a little definition about that, and then we can get into the the weeds and the plants of things here.
Love it. All right. So here's the deal. Insulin resistance is generally thought of as basically being the cause of prediabetes and type 2 diabetes, but it is so much more than that. Okay. Yes, it's a true statement that if you develop insulin resistance, you can develop prediabetes, which can turn into type 2 diabetes. There's no question about that. But beyond any flavor of diabetes, insulin resistance is a gateway to chronic disease. Okay. So if you look in the literature and you do a bunch of reading because you got nothing better to do with your life but confuse yourself, what you'll find is that insulin resistance can influence almost every chronic condition that we know about. And these chronic conditions include many versions of heart disease, whether it's high triglycerides, whether it's high cholesterol, whether it's atherosclerosis, whether it's coronary artery disease. Okay. It can also influence cancer. The more insulin resistant you become, the higher your risk for many forms of cancer. It can also influence your risk for developing obesity, because there's a very strong connection between insulin resistance and weight gain and or insulin resistance and obesity. And then in addition to that, insulin resistance is also connected to many other what are considered like inevitable consequences of living with diabetes. You hear this all the time. You go to the doctor and they're like, oh, hey, Cyrus, you're living with type 1. By the way, you should just subtract 10 years from your life. And I was like, I'm sorry, what? They were like, yeah, when you live with type 1 diabetes, your life expectancy will go down by approximately 10 years. And I was like, why? And they were like, well, because some inevitable consequences will set in at some point. And I was like, which consequences? And they were like, well, it'll either be peripheral neuropathy, which is, nerve tingling or nerve damage that causes tingling in your fingers and feet. Number two, you can also get chronic kidney disease. You can also get cognitive decline, like we talked about earlier. You can also get erectile dysfunction. And you can also develop fatty liver disease.
I think they should have led with erectile dysfunction.
Yeah, for sure.
I mean, if you want to fix anybody and you say you're not going to get a boner anymore, I think most dudes are just gonna be like, all right, what do I need to do?
Yeah, exactly. As you saw the movie The Game Changers?
Uh-huh.
Yeah, exactly. It's like, that's the scene that everybody talks about, is that, you eat a plant-based meal and all of a sudden you can have an erection for a longer period of time and you stay harder longer, which is awesome. Who doesn't want that, right?
Rick James, eat your heart out.
So the point being is that, insulin resistance is a gateway. The more insulin resistant you become, the higher your risk for many chronic diseases. And as a result of that, if you can control and or reverse insulin resistance, then what you're doing is you're simultaneously lowering your risk for so many chronic diseases at the same time. Mm-hmm. So it's almost like you can think of it as being like one of the most powerful drugs ever invented, right? I can give you a plant-based diet prescription, and then I can lower your risk for so many different chronic diseases that it's truly one of the more powerful things that the scientific world has ever discovered.
Yeah.